Welcome to the Working on Wellness On-Demand Learning Series. I'm Jen Anderson, Clinical Quality Improvement Director for Community Health Association of Mountain Plain States, also known as CHAMPS. CHAMPS supports the needs of health centers in Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming. Each episode in this on-demand learning series was brought to you with the generous support of our partners at the Rocky Mountain Public Health Training Center. Each of the episodes in this series was recorded in June of 2021, and each provides a different presentation from an expert in the fields of psychology, resiliency, or mindfulness, and are designed to help you reflect on your state of being following the COVID-19 pandemic. Some episodes offer tips on personal resilience, some focus on the specific needs of healthcare providers, and some will help you think about your opportunities to support others in your organizations that you're either a part of or that you lead. Each episode is available for you to view and share with others at your leisure. Additional resources to accompany each training can be found on the CHAMPS website where these recordings are housed. We hope that attending this on-demand training will enable you to bring new skills and tools to your job and strengthen your ability of your health center to deliver high-quality community healthcare, primary healthcare to your communities. When you're done watching this presentation, please take a moment to complete a brief evaluation that can be found linked under each presentation. For today's episode, we'll hear from Dr. Abbie Beacham. Abbie Beacham, PhD, is a clinical psychologist who spent her career working in healthcare and medical settings. She has her PhD in clinical psychology from the University of Louisville, completed her internship in clinical health psychology at the University of Florida Health Sciences Center, and postdoctoral fellowship at the University of Kentucky Colleges of Medicine and Dentistry. Over the past 5 years, she's worked extensively with physicians and other healthcare professionals in addressing their stress, burnout, and well-being. As part of this work, she collaborated with colleagues to develop and implement an evidence-based well-being programs for health professionals. Her most recent training, Cultivating Personal Resilience, has been presented to hundreds of professionals in both in-person and online formats. In 2019, Abbie relocated from the University of Colorado School of Medicine in Aurora, Colorado, to assume the position of Director of Behavioral Science at the University of Louisville School of Dentistry in Louisville, Kentucky. A licensed psychologist in Colorado and provisionally in Kentucky, she maintains a small private practice serving healthcare professionals via online consultation and therapy. Abbie, thank you so much for your time today. Now, over to you.
Hi, everybody. So this presentation is Burnout and Well-Being, Regenerating Your Balance. My name is Abbie Beacham. I am I'm coming to you with some sort of history in doing things around burnout. I started this work about 6 or so years ago and began doing research in burnout in healthcare professionals. And some of the information I'm going to go through today is part of some programming that we developed a while ago to address well-being in professionals. So what we're going to be doing in this presentation today is going to be done in 3 parts. The first part I'm going to do is burnout. The second part will be addressing how we think about well-being in the work that we do. And then the third part is really targeting how you can regenerate balance that suits your needs, that's tailored to you. Now, there are a couple ways you could go about going through this particular video or podcast. You could just listen to it or watch it and do it double time. You could just kind of go through it. But periodically in the presentation, I'm going to have this slide. And this slide is an indication that it would be a good time, if you felt so inclined, to pause the recording and go ahead and reflect on a specific question that I pose at that point. So I've tried to make it so that periodically we ask you a question, have you think about something, maybe do something, and then we present you with more information. So let's just start from the very beginning. Part 1 is burnout. It's not unusual that when the media covers burnout, you might see something like these matches that are all burned out, or tired people slumped over their desks. Right now, the number of articles and features on burnout are just astronomical. In fact, if you Google just the word burnout, this was yesterday, and I got over 6.5 million results. Now, I think it's important to think about it on a personal level. So right out of the gate, I'm going to show you this slide. Here's a time to pause and reflect. Looking back on your career, your work, whatever it is that you're doing, have you ever been burned out? And if you reflect on that for just a moment, how did that show up? Did you catch it in yourself? Did somebody else bring it to your attention? What did you notice? Or what do you tend to go through when you feel like you're experiencing burnout? So here are a couple of headlines. Leaders and employees are burning out at record rates. This was in February of this year. What burnout really means and what bosses and employees can do about it. And that was just in this month of this recording. Empowered doctors and staff foster low medical practice burnout, talking about the degree of control people feel like they have. 5 secrets to work-life balance from a TikTok famous burnout coach. I have to confess, I wasn't aware that there were burnout coaches. So news to me. I don't know what the 5 secrets are. But the way that burnout is described is as an occupational phenomenon. And it's in actually the International Classification of Diseases, the ICD. We're on version 11 now. The World Health Organization is careful to point out that it is an occupational phenomenon. It's not considered a medical diagnosis, but it's getting a lot of more formal attention. And we're getting a lot of attention to burnout across the board. Those headlines I showed you from the Wall Street Journal, from Forbes, from healthcare periodicals, and from NBC. So there isn't really any outlet that isn't covering burnout. So what I'm going to do in this first part is I'm going to talk about what really is the definition of burnout. And I'm going to talk a little bit about how that shows up in different people. So if you think about burning the candle at both ends, being a precipitator of burnout, what is tending to happen in the media is that emotional exhaustion, feeling used up at the end of a workday, has become this proxy for burnout. I mentioned that in some of the media, you might see someone sloped over their desk, completely exhausted. That has been used as an indicator of burnout. However, it's really not an either-or phenomenon. It's a little more complex, and there are more nuances and components of burnout than just the emotional exhaustion. And the exhaustion that people feel after a workday, particularly, when we talk about the increase in this exhaustion during this period of COVID, that has, whether or not it meets the criteria for burnout, has to do with the intensity of the experience and the frequency with which people experience it. Now, there are 3 dimensions to consider when we're talking about burnout. Early research on burnout actually started in the early 80s. What they found through a series of research studies was that the 3 dimensions that emerged was exhaustion, cynicism, and the sense that people aren't being effective or efficacious in their work, professional inefficacy. So I'm going to talk about each one of these areas. In terms of exhaustion, wearing out, loss of energy, depletion, debilitation, and fatigue. If you think about that, we're all tired at the end of a busy workday. That would be normal. I am a psychologist. I've worked in a lot of clinical settings, including primary care settings. I've worked in, right now I work in dentistry, and I worked in pain centers. And one of the things that I notice is that from time to time, I would be tired after seeing a lot of patients, doing a lot of stuff at a rapid pace. And sometimes getting up the next day, I was still exhausted. That happens with some regularity. But what we become concerned about is when it happens nearly every day for a long period of time, and we're not getting that recovery. That's the emotional exhaustion or the exhaustion component of burnout that we're really referring to here. The second component, cynicism, used to be more often referred to as depersonalization. And I think that term was actually kind of confusing to people. Depersonalization has to do with sort of a dehumanizing experience for people. They feel detached, negative. They might have inappropriate attitudes toward what we refer to in the burnout literature as recipients of their services. Might be patients, maybe our students, maybe our colleagues, people that we supervise. We have detached concern. That part of dehumanization or cynicism around what some people might say is reduced empathy, being irritable, loss of idealism and withdrawal. This is the kind of phenomenon that occurs when humor gets a little inappropriate, that some people just can't seem to shake that cynical viewpoint on a daily basis. And again, this has to do with intensity, but also the frequency, that over time, the normal ebb and flow that we would expect from the human experience tips into this frequent, intense cynicism over time. The third part, or the third facet and domain of burnout, is professional inefficacy. That sense that you're just not being effective in your work, can't accomplish what you're setting out to accomplish. It affects morale over time, and it affects our ability to cope with what comes our way in our work. Now, I mentioned I work in a lot of different clinical settings. One of the things that would occur at the end of the day is I sometimes wondered, oh gosh, does anything I do even make a difference? And that inefficacy happens periodically. It's part of doing work. But again, over time, if it's persistent, then it might meet criteria for burnout. So here's a pause. This is a time that you might really want to pause the video and think for just a moment. Are any of these ringing true for you? Are any of these ringing true for colleagues? Because often it's colleagues who notice something in one another with regard to burnout. So in terms of the exhaustion, the cynicism, the feeling of being ineffective or inefficacy, is that ringing true for you on any level? And if you do notice it, you might just look back and say, when was that? What was going on? How did that show up for me? Now, I'm going to talk about some burnout profiles. This is relatively new. When we think about burnout, I think there was a period of time where you were either burned out or you weren't, and people really didn't differentiate the many ways that burnout could manifest in people. And they talked about essentially, you just need rest. I think this is an excellent quote by Leiter and Maslach, who are really the two most prolific researchers in burnout. People experiencing burnout are not simply exhausted or overwhelmed by their workload. They've lost a psychological connection to their work, and this has implications for motivation. And for many of us who worked hard to have this kind of a career or really identify with the work that we do, it has implications for our own identity. There are 5 profiles that these two researchers have identified. The first one is considered the opposite of burned out, and that's the engaged profile or engagement. When they measure the 3 parts of burnout, you have low scores on exhaustion, low scores on cynicism, and low scores on inefficacy. And I just want to point out really quickly that I'm going to put this little pointer right here because that's the teacher in me. Efficacy has a reverse score. So the higher score on the efficacy bar actually means it's higher inefficacy. So in this profile, it is the opposite of burned out. And engagement has long been considered the opposite of burned out. So low exhaustion, low cynicism, and low efficacy. This profile is the burnout profile. It's kind of the classic burnout profile where you have high exhaustion, high cynicism. And maybe the efficacy one isn't quite as high, but the exhaustion and the cynicism, when they come together, that's considered the traditional or classic burnout profile. And we may have experienced that. The overextended, which is kind of what the media has picked up on, and I mentioned this in the beginning, is that the overextended is just exhaustion, not being able to get back up, feel energized, and feel engaged with work, but not necessarily cynical and not necessarily like they're being inefficacious. So this is the overextended profile. Then there's a disengaged profile. This is a relatively newly identified, 2017. This is the highest score in cynicism, but all of them are relatively moderate scores. But this disengaged is it not necessarily exhausted, not necessarily feeling like, oh, gee, I'm not making a difference, but having that higher cynicism to the degree that there is this withdrawal, as I talked about when I defined the cynicism, the withdrawal from the work that people are doing and the people with whom they do the work. Finally, there's kind of a profile that doesn't show up all that much, where it's low exhaustion, low cynicism, and moderate to high inefficacy, just like I'm not sure anything I'm doing is mattering. So those are the 5 burnout profiles. And here is what researchers have begun to say. If this showed up for you or you identify with a profile that you've had in the past, it sort of predicts how it'll show up for you in the future. Now, I've had times where, I'll just be honest, I have exhibited 1 or 2 of these profiles. What comes to mind right off the bat is when I worked in emergency services for a mental health center that I covered a 17 county region solo on weekends, and I worked overnights. Now, eventually, I noticed that my cynicism was kicking up. I was certainly fatigued because my sleep was disrupted, among other things. And I wasn't certain that I was actually making a difference. And so I remember distinctly having that experience and that I struggled through it. Eventually, I switched jobs. I'm not sure that's always the solution for everyone, but looking back in how burnout has shown up for me in different places, it'll probably be similar in the future when I experience it. So here's another pause to reflect. If you have a moment to think about these profiles are considered person-centered. That is that the way that they're looking at data about burnout now, different people exhibit specific profiles that are really specific to them. And then the question becomes, what do we do about it? Because it's not an all or none proposition, and it's not a one size fits all. So this makes it a little more complex when we think about what do we do about this phenomenon that now is recognized worldwide. It is really important that I recognize system drivers of burnout. The systems that are faceless, that make the rules and make the structures in which we work. That's why I have this very tall building that you can't even see for the clouds because you don't know who's at the top. But system drivers of burnout are the thing that people point to when they say I'm burned out. And that is absolutely true. So early on, when I was working in this area of resilience in healthcare, I had coffee with a colleague, and I was trying at that time to figure out, well, what is it that I can bring as a psychologist? And I wanted to develop programming. I wanted to do something meaningful. I didn't want to just be the psychologist who sits in an office and waits for someone to come to my door because, honestly, people aren't going to come to my door. But we met for coffee, and I told her about the work I was doing and what I wanted to do. And she said to me, and I won't forget it, to imply that I simply need to meditate or do yoga to cope with a system that's killing me is frankly insulting. And I agree that systems and structures have a way of drawing, our fatigue and all of those components of burnout. And so I wanted to look more deeply into what are the component parts of this. Now, researchers are pretty quick to point out that what we have that's related to burnout are mismatches. Mismatches in what is expected of us, mismatches in what we're provided to do the work that we have to do. And there are 6 primary areas. So, number 1 is our sense that we can't accomplish what we need to accomplish. We can't do the workload that we have on hand. Now, this has been pointed to a lot during COVID. One of the things that happened is many of us started working at home. And what we sort of did was we worked all the time because we were always in a space where we were doing the work. And home became blurred with work. And we found that a lot of people were saying, this is untenable. I'm trying to do too much and I can't do what I feel is expected of me. A second area, and this is an important area, and actually one of the headlines I showed you right out of the gate showed that control or a sense of autonomy, allowing people to be empowered to make decisions about their workday, when they do things, how they might go about doing things, has a lot to do with how people might get burned out. Reward. Not just getting paid for what we do, but having reward and acknowledgement of the contributions we make. If there's a mismatch there, people really feel it. Another area is community. And we might think of it in terms of, social support or being connected to our colleagues. When we lack that connection or we don't have that respect and regard for one another, it'll draw on our resources. Fairness. Fairness and equity in the workplace is another thing that if people perceive, I'm not being treated fairly by the system, I'm not being treated fairly by the people in the system, that really does tend to, got ahead of myself, that does tend to draw on people's resources as well. And I saved one of the most important ones for last, values. If our workplace and our work community, the values that they seem to hold most important don't coincide with our values, that actually can show up in terms of burnout, because it's hard to show up to work if your values don't match your workplace values or the organization. Now, I'll go back to what I did. The workload component is most related to the exhaustion profile, which makes total sense. The other components are more related to the other kinds of profiles. And you could probably sit down with the different kinds of profiles and see, well, what is it that's most connected to cynicism? What is this most connected to feeling like I'm not feeling efficacious in my work? I do provide references for this particular work in the slides at the bottom. So if you're inclined to look it up, it's pretty interesting reading, and it's more detailed than I can get to in the context of this presentation. So one of the things that I like to do is to introduce this concept of this is normal, that at one point or another in our work lives, we're going to experience burnout symptoms to one degree or another. I did a podcast with a colleague, and we were talking about burnout in healthcare. And I talked about how a lot of times when people came to me and were talking about their own burnout or colleagues' burnout, it was sort of portrayed as, well, that's it for me, that this was the end game, that if you got burned out, there was no coming back. And the more I heard and the more I looked into it, I found that really this is something we all experience. And so if we talk about it like it's a normal phenomenon, not something that's necessarily career ending, then we can work with it a little more easily. So I invite you to reflect on that and think about if you're supervising people or you're working with colleagues or you work in teams, this is something that we all experience, and there are things that we can do, even though we're not the biggest decision makers in our organization, that we can do to work with it. Now I'm going to talk about well-being. So I spent a good bit of time on burnout. I'm going to introduce how we have thought about well-being in our work that we've done through ECHO Colorado and in the programs Cultivating Personal Resilience Levels 1 and 2. It became important to me to find a way to talk about well-being that allowed people to see themselves and their own unique preferences and their unique needs and values, because I'll always come back to values, in a model that works for them, in a way that they think, that makes total sense. So if you spend any time on social media or media at all, or you read any of the articles that come out about burnout and well-being, there's no shortage of advice. Run, don't run. Drink red wine, don't drink red wine, do yoga. If you're an introvert, spend time alone. If you're not an introvert, don't spend time alone. Have kale, don't have kale. Other dietary recommendations. Have coffee, don't have coffee. Do meditation, don't do meditation. What is mindfulness? There are a lot of different ways of thinking about it. Have melatonin if you can't sleep. And have you tried the weighted blankets? So a lot of people have ideas about what will help. At the end of the day, when all of those ideas and opinions are shared, the reality is we have to think about what's true for us, what's true for our values and who we are. So that's why I really, really appreciate what's referred to as the PERMAH model of well-being. And I'm going to walk through that now. The PERMAH model of well-being was initially developed at the University of Pennsylvania by a psychologist named Martin Seligman. If you follow his work at all, he also wrote a book called Learned Optimism. He's done a lot of work in positive psychology. And I'll be honest with you, when I first started the work in resilience, and some colleagues said, we're really interested in the positive psychology stuff, I thought, I'm not too sure about that stuff, because as a clinical psychologist, we certainly aren't trained to look for the positive. We spend all our time diagnosing and looking under rocks for pathology. And so I wondered about it. And the more I looked into it, maybe you call me cynical, but the more I looked into it, the more I realized there's some pretty powerful stuff in this literature and in this programming. And so if you feel inclined, you can go to the University of Pennsylvania Positive Psychology website. You see a lot of resources. Among them is information about the PERMAH model. Now, the PERMAH model says we all have 6 components that lend themselves to our own personal well-being. So we'll walk through each one. The first one is positive relation or positive emotion. And positive emotion is not to the exclusion of negative emotion. Rather, they do coexist. But the ability to engage in things that generate positive emotion is really pretty important to our well-being. Engagement. Engagement is being involved in what we're doing, being present in our tasks at hand. Positive relationships. And these are relationships that are not just the most significant or family relationships in our lives, but they also refer to relationships with people that we just see on a daily basis. I love coffee. I love coffee shops. It's sort of my guilty pleasure. When I go to work, I typically have a coffee shop stop on the way to work. And I don't just go for the coffee. I like just saying hello. Those kinds of what we might not even notice as significant relationships actually play a role in our well-being. They bring us a sense of connectedness and joy, even if it's just for a moment. Having a life or days that have meaning, have purpose, something a little bigger than ourselves. There are many ways to define this, but having meaning and that sense of purpose is part of well-being. Sense of accomplishment. I do a lot of these courses online, and sometimes people say, well, I don't understand. If I accomplish stuff at work, is that all I need? Because I'm not sure how that contributes to my well-being. But accomplishment can be across the board in how we spend our days. For me, frankly, I feel pretty accomplished if the laundry gets done and folded, because it just gives me that sense of completion or something. I don't know. It's different for everybody. And that's one of the major advantages of this model. It's different for everybody, which brings me to health. So health in this model is purely subjective. That is, I always talk about how one time I was presenting this model in an auditorium of about 80 people. And when we did this, somebody said, well, if you look at a checklist of what makes a person healthy, I would hit everything. But I don't feel that healthy. I don't regard myself as subjectively feeling healthy. And then somebody else in the room said, well, that's interesting, because if you looked at that checklist, you would say, I am not healthy, but all things considered, I feel healthy. And so in each one of these areas, it has to do with our own interpretation and our own experience. And that's why I talk about what's true for you. In the middle of all of this, there is this balance. Now, you've seen this little person standing on one leg, balancing throughout the presentation. Soon it'll become clear to you just exactly what this is referring to. Life balance is like standing on a wobble board. It's a dynamic equilibrium. When I first started doing this work, it was kind of interesting. There were lots of requests for work-life balance presentations. Can you come and talk to us about work-life balance, and then we'll do it? And work-life balance is one of those things that Do you ever get there? Is it even possible to have that balance? And is it a destination, or does it come in moments? And I started thinking about this, and actually I remember where I was. I was working in Colorado at the time, and it was a snowstorm day, and I was working on this, and I had a cup of coffee, of course. And suddenly it hit me that work-life balance, or balance at all, comes in moments, and it's always shifting, always shifting. And if you've ever been on a wobble board, you know that when you first start trying to pay attention to this balance, it's really hard. It goes all over the place. It's wobbling, wobbling, wobbling. As you practice, you begin to notice shifts sooner and to make compensatory adjustments in the balance to come back to center. And I got real philosophical about this, and I thought, wow, that's really what it's all about. Noticing things sooner, being aware of shifts, because it's not going to stand still. And that dynamic equilibrium is really about being on a wobble board. In fact, in the courses that we have through ECHO and Cultivating Personal Resilience, the vernacular is about, where are you wobbling? What do you notice when you wobble? And we're all basically fellow wobblers. So here's another moment that you can pause the video and reflect just a bit. Are there times when you feel more or less on balance? And what are you doing? How long does it last? When was the last time you felt on balance? Was it a long time ago? Was it just today? And did you notice going off balance before the wobble board goes and you really lose your footing? Or did you notice sooner? Something to ponder, something to think about. Here we have a group of professionals who are, that's me actually up in the right. They're all coloring with crayons. Now, early on, when we started doing these kinds of programs, I had this thing, which I'll show you in a minute, and you have it for your own resources, that people color in where they are in each of these areas of the PERMAH model. And I used to think, oh my gosh, I don't know. I'm taking crayons in to really accomplished professionals. I don't know how this is going to go over. But what I found was the process of coloring. If you really take the time to color and think about each area of the PERMAH model, you're contemplating where you really are. And, you know, by and large, people really got a charge out of coloring. Some people use straight edges to make sure they didn't go outside the lines. Everybody had a way that they did it. And I always saw this sort of concentration on people's parts. The room would fall silent. And this is a room that has a couple, I would say 100 people in. It would fall silent, and all you heard was coloring. It was amazing. And it told us a lot. So now you have this available to you. You can either print it out from the slides that you'll have available, or it may be in your resources as a separate document. But here is what we do. We go through each portion of the PERMAH model with a question. And you answer the question where 0 is at the center and 10 is at the outside. And you color where you feel like you are, where you would score that area of the PERMAH model. And then it looks a little like this. Now, this is adapted from a measure of the PERMAH profiler. It's called the PERMAH profiler. And again, we provide you with references. You can actually go to their website, take the whole thing, and get a comprehensive report if you feel so inclined. What we try to do is just sort of get a broad brush, a broad stroke of what people's first intuition tells them about where they are and where they might want to pay attention. Now, notice, we don't say this is what you do to feel like this is more in concert with where you'd like a particular area to be. We don't prescribe activities or diets or whatever it is that we think will bring people balance. We might offer a lot of options, but this is an opportunity to pay attention. And it could look like this, might look a whole lot different. So the last part of this presentation is designed to help you think about how do you regenerate your balance. We've talked about burnout. We've talked about how burnout looks for different people. Balance looks different for different people. How I bring myself back to center will be different for me than it is for many of you. We're also talked about system level factors that predispose people to burnout. And I'm going to talk a little bit about that again, because I don't want to ignore that. I am not Pollyannish by any stretch of the imagination. And I'm not saying, oh gosh, if you just do this one thing, you won't get burned out. What I say is we all get burned out. Some things are within our control. Some things are not. How do we navigate this wobbling of the day-to-day life that we live when things are thrown at us that throw the wobble board off balance? And that is a regenerative process. So the question is, if resources are depleted, how do we regenerate them to find balance? A lot of the stuff that is recommended, particularly with regard to looking at well-being, is actually regenerative, that we can engage in even the smallest activities over time to bring ourselves back to center, noticing shifts sooner and coming back to center. So the question for you is, during moments of balance, if we were to follow you around and the times that you've identified, those are times when I was on balance. Those are times when things felt like they were in sync. What would we see you doing? What would you be doing? And doing can be something external. I'm exercising. Doing can be engaging in thought processes or meditative activities. They can be internal, they can be external. But what would we observe? What would you observe in yourself as you look back? And what things would foster or build each aspect of the PERMAH model? Positive emotion, engaging in activities that generate positive emotion, engagement, and that is engaging actually in being present for the activity. When was the last time you did something like that? One of the things that's completely engaging is laughter, humor. And you can't be anywhere else. You can't be in the future. You can't be in the past when you're engaging in really laughing about something. You're really in the now. Positive relationships. And again, small things in big relationships, small things with seemingly insignificant relationships. Meaning and purpose. What fosters and builds that for you? What fosters and builds a sense of accomplishment for you? And finally, what builds and fosters a sense of feeling healthy and connected? And that can be mental health, it can be physical health. And what of these things help generate balance, regenerate balance, coming back to center? Now, I promised I would talk about the system. Systems change at glacial pace. And this is a topic of much debate that while we work on our individual ways of navigating how things ebb and flow or wobble or go off center, whatever you want to call it, the system may not change. We're still working in the system. And while we wait, we can tend to our ability to navigate or ride, I'll just call it the wobble. One theory that discusses this is the broaden and build theory of positive emotion. This is from Barbara Fredrickson. And in this theory, she emphasizes that positive emotions are essential to optimal functioning. And they're essential to what is really becoming a fairly robust science around well-being, creating and regenerating well-being. Now, in the broaden and build theory, she talks about how small efforts, that is, 5 minutes, 10 minutes, and this comes up a lot when we do these courses in resilience, that people having time to engage in the activities that help them feel on center, time is at a premium. We are all overworking, it seems, and we're exhausted. So how much time engaging in what activity or what effort does it take to make a meaningful difference in one's own well-being? We talk about, would 5 minutes make a difference? Would 10 minutes make a difference? Could we find that time to engage in something that cultivates joy or connection with another person? According to Dr. Fredrickson, she has shown over time, small efforts do have a cumulative effect. And it broadens our repertoire of being able to navigate these undulations or wobbling on a day-to-day basis. And it builds our ability to be resilient, to come back to center, to bounce back. At the same time, our base of well-being becomes stronger and stronger. So I'm going to go right back to what is true for you. In this brief video, I hit a lot of stuff. And one of the things that we find ourselves looking for is, well, what do I try? What do I do? We come right back to it. It's about our own values and what is true for us, for ourselves. And so it's up to us to figure out what goes in those bubbles and to try stuff and to build our resilience, build on the small efforts over time of trying things and broaden our repertoire. So here's an example. In the last 18 months, I'll say, some of us have had to get real creative around how do we do fitness stuff? We're not connecting with other people. How do we connect with other people? We have all had to broaden our repertoire. And we've all had to build our ability to connect and have a sense of well-being in a pandemic. Now, one might argue that we have built skills that we didn't expect to build. And we might be able to capitalize on those skills going forward. But it all comes back to what's true for you. So, what's true for you in creating and developing and facilitating positive emotion? What is true for you in terms of the thing that feels on center in engaging in certain activities? For me, it's creative activity. But creative activities can be a variety of things. For some, it's writing. For some, it's painting and drawing. For others, it's cooking. What is true for you in having positive relationships, positive connections with other people? What is it that has meaning and purpose in your daily life that you engage in and make sure you touch on and have that connection with every day. It's different for all of us. A is accomplishment. What is it that in our daily lives we might be realistic in saying, I accomplished that. That feels really good. That's part of finding the center, finding the balance. And then finally, what is true for you with connecting to health, your balance in your health? That takes some time to think about. It takes some exploration. It isn't something that we're taught to think about very much. And so this is an invitation to you to think that through and to really take a look at it. As I mentioned, you can go through this video and just go check. I listen to it. Or you could do a little exploration and see, how does this apply to me? Some of you may say, this isn't for me at all. And others of you may say, there's something here. So here's what we covered today. We talked about burnout. I talked about how the media has begun to regard it as if it's exhaustion, it must be burnout. And I covered the complexities around it, the three components, and how there are individual profiles that emerge. And so I invite you to think about how that might apply to you, how that might apply to people that work for you or people with whom you work on teams. Those 6 components of work that when there's a mismatch, it sets us up for burnout. So I spent a fair amount of time on just burnout. Now, then I introduced this model, the PERMAH model of well-being. And the reasons that I like that model, including that everybody has those 6 components of well-being, but how we achieve well-being within that model is different for all of us. I encourage you to take a look around at some of the references for the well-being stuff. You might find that the increased detail in that area interesting as well. And then finally, this is a regenerative process. And we don't run out of well-being. We might have to adapt what it looks like, but we can regenerate aspects of it. And I just want to mention that I don't disregard the structures and systems with which we work or within which we work, because we have to learn to navigate those, or we have to determine what do I need to do to flourish? And what do I need to do to have a sense of overall well-being? And again, it's different for all of us. So we've covered a lot here, and I covered it probably fairly quickly. I tend to talk fast. So you may want to go back through something that has particular interest to you. I invite you to pause and reflect. I also invite you to get some crayons out. What the heck? Color that thing in, that circular model, and then maybe take a look at the longer questionnaire that's offered on the website associated with the PERMAH Profiler. It's called the PERMAH Profiler. So, thanks for tuning in. This is not my best look, but I'll go ahead and share it with you because we're all fellow wobblers. May we all have moments of balance and wobble on. For more information on the work that I do, visit us at projectwellbeing.com. Be happy to work with you more. Thanks again. Bye-bye.